Hi, I'm Kevin Henry. I'm managing editor for Dental Economics and the editor of Dental Office magazine. And I have on the phone with me today Linda Miles and Dr. Rhonda Savage, both with Linda Miles and Associates and the Speakers Consulting Network. And we're going to talk a little bit today about how doctors and staff members can both benefit from setting up a trip kitty and a way to kind of motivate the staff and have everybody travel together. Linda, would you like to start off talking a little bit about this?
Yes, thanks, Kevin. First of all, I just really feel that continuing education is such an important part of practice success that about 10 years ago, so many of our clients were wanting to do our Sun Fun seminars and our cruises and so forth, and they just didn't have the funds, or they felt like they just couldn't afford it. So we came up with not one but many different or several different incentive bonus plans, one of which is called the Continuing Education Trip Kitty Fund. And basically it's set up by volunteers in the office. There will always be one or two who say they can't travel perhaps or whatever, but it actually works out so much better if the entire team and doctors can all attend, of course, together. The trip kitty is that each of the team members signs an agreement that they are very excited about going to a major meeting once a year and a fun retreat, and therefore they're willing to come in and work a half a day per month treating patients, and they all sign an agreement that they are contributing to their professional growth and development fund, and they do not expect to be monetarily compensated. However, always circumstances may occur that maybe they'll be transferred or they'll have to quit their job, and if that happens, they are paid for any hours that they have worked on those half days, so that they can feel that they can contribute their time and energy, but if by chance they leave, they are compensated for hours worked. So this actually works out very well, and if the staff salaries in a practice are 25%, I'm just pulling that number out of the hat because it's usually 20 to 25%.
Right.
And if it's 25%, theoretically, with the doctor donating his or her time, the doctor is paying 75% of the continuing education, and collectively the team would be contributing 25%. But I do believe that team members who personally contribute to their own professional growth and development get so much more out of the continuing education than those that are just taken on trip after trip, and their body may be there, but their heart is not as much in the trip. So, Dr. Savage, I would love for you as one of our long-term clients to tell us a little bit about how you and your team members have used the Trip Kitty in the past and exactly how it worked for you.
Sure, Linda. I started my career as a dental assistant, 4 years as a dental assistant and 2 as a front office person. And the doctor that I worked for in Alaska believed very strongly in continuing education. So he took us on some trips where we were there for CE, oftentimes to Hawaii and sometimes down to Oregon, different places. And that really helped build a fire in myself as far as what we could do when I became a dentist. And so when I started my practice in '92, and I worked with Linda as far as systems in my practice, one of the things I wanted to do was have the staff have that enthusiasm and motivation for continuing education. And so we set up her Trip Kitty at that point. So, Linda, it's actually more than 10 years that you've been doing this.
I think it's been about 15, as a matter of fact.
It's been quite a while. And with that program in place, I took my staff to Cabo San Lucas. We made a trip to Cancun and heard Linda speaking in Cancun. I've taken them to the ADA meetings, most recently to Las Vegas. And we've made several trips to Hawaii. And this has all been with their contribution towards the trip. And you can do this in different ways. It doesn't have to be specifically a half day set aside, because some doctors don't want to set aside additional days per week. And one of the things that we did was this was in the days before Zoom whitening, with all of our whitening cases, we set aside half of the whitening fee into a Trip Kitty, so an interest-bearing account. And what that did was that created enthusiasm and motivation for the staff to present the whitening to the patient. And then And that also created that dialogue between the patient and the staff as far as cosmetic procedures, which helped me as the doctor working with the patient on cosmetics, because the patients will really, really listen to staff when it comes to cosmetic treatment and what their options are. And so I felt in my practice that if a staff person wasn't willing to learn and grow with my practice and help invest in themselves, then that really wasn't the right practice for them. And
Good point.
And by doing this and building the fire within them, it made them valuable, very valuable long-term employees that then I felt as a doctor I could reward on an annual basis from a merit pay increase, because they had shown that enthusiasm for continuing education.
Fantastic.
Very nice. So what's the best way if a doctor is interested in starting a Trip Kitty? How's the best way to get the ball rolling?
Well, one of the best, and this is the one that we will be happy to send out to any practice by email if they would like it in writing, and they just have to email us at Linda, LINDA, MILES@COX.net, or Lee, LEE, Tarvin, TARVIN, @Cox.net, and we'll be happy to send them one of the Trip Kitties funds, or maybe, Kevin, we can even download that. I'm not sure if you would like to put it on your site that they can just download it if they prefer to do that.
Absolutely, we could do that as well. If then it'll be available real soon through www.dentaleconomics.com, all one word.
Wonderful. Sounds good. One of the ways that they started is that they figure out what their average daily production is, and let's just guess that maybe their production per day might be $6,000. In a 2-doctor practice, it could be $12,000. 3 doctors, it could be $18,000 a day. So whatever their daily productivity level is, if they contribute 4 hours a month, then they take their average half day, not that particular half day, because if you use that particular half day, they will kill the doctor that day. So too much production.
Makes sense.
And so let's just say, for instance, they do $5,000 a day. So every single month, without fail, they write a check to their professional growth and development or their Trip Kitty fund, and it should be an interest-bearing account. And then you can really save a lot of money. If you're putting away $2,500 a month in a solo practice, you can see how that would quickly add up and be able to be used for CE.
That's great. Well, it sounds like some good information. It sounds like some things that the doctor and staff can work together and all can benefit from it very, very much.
Yes, and I'm sorry for my telephone ringing in the background.
Well, it turns out you're a busy lady, Linda, so that's okay.
If you saw my desk, you'd know that, because what do they say, a crowded desk or a cluttered desk is the sign of a busy person.
There you go. Well,
I am very busy at the moment, but we're just real excited. Dr. Rhonda and I are both hoping that every single dental practice that listens to this can absolutely be part of our upcoming exciting trips that we're planning.
Sounds great, and I know we'll have more information about that coming out real soon.
Absolutely. Thanks, Kevin.
All right.
Thanks,
thank you, Linda. Thank you, Dr. Savage. And thank you for watching this interview on DentalEconomics.com.
Great. Thank you.
Bye-bye.